The prevalence of anxiety and its solutions amongst DPT students during a pandemic. COVID-19 pandemic brought significant change and challenges for individuals all around the world by having to social distance and isolate. Students had to learn virtually, which was very difficult and stressful. Researchers hope to investigate the impact of the pandemic on DPT students' anxiety. So due to the very pandemic, we all know there was a lot of social distancing, wearing masks, staying at home. People were laid off, causing financial stress. Parents had to assist in homeschooling their children, and learning was completely remote for some students, especially in the DPT program, which is normally a hands-on profession. So the purpose was to assess the impact of the pandemic on the students, the degree of anxiety based on their demographic factors, and figure out the common coping strategies. To investigate, we were looking at females and males, who will have higher trait anxiety scores, the age, marital status, and students with and without children. All DPT students are working more than 30 hours a week versus those who are working less than 30. All DPT students who use coping strategies for anxiety will have lower state anxiety scores compared to those who do not use coping strategies. All traditional DPT students will have higher state anxiety scores compared to bridge DPT students, and the students of cohort 2022 will have higher state anxiety compared to the cohort of 2023.
Introduction. Anxiety is the feeling of worry, fear, and uneasiness. State anxiety is anxiety induced by a situation, where trait anxiety is anxiety as a generalized response across many situations. Introduction continued. Anxiety is higher in females in the younger population and with greater responsibilities. Anxiety is lower in individuals with coping strategies and in married individuals. Participants. There are 44 participants from the University of Finlay. 17 were of the traditional DPT students and 27 were PTA to DPT students. Cohorts of 2022 and 2023, ages 20 to 59 years old. We included them if they agreed to participate. They were the University of Finlay's DPT students in the cohorts of 2022 and 2023. The demographics here are of gender and nationality. The demographics here are of work and child responsibilities.
Here is a quick overview of the data process. We emailed the state trait anxiety inventory for adults along with a demographic survey to the respondents. The data was collected and analyzed using a 2-sample t-test with equal variance and an ANOVA analysis. Significant findings of these tests demonstrated that respondents over the age of 30 tend to have higher trait anxiety, and the cohorts graduating in 2023 have both higher state and trait anxiety. Looking at the causes of stress and anxiety is caused by schooling scoring the highest, with family duties and careers not far behind. And then the next graph represents anxious behaviors, with the most common behavior being loss of sleep.
Exercise was the most commonly reported coping mechanism, followed by meditation. And how has your life changed since COVID started? There was a change in anxiety, family changes, and social changes were the top reported answers. And coping strategies related to academic performance included time management and meditation or self-care strategies. Hypothesis 1, there was no significant difference in gender, in anxiety between genders. And our second hypothesis, there was no significant difference in state anxiety, although there was a significantly higher trait anxiety noted in individuals older than 30. Our third hypothesis, there was no significant difference in those who were married and no significant difference in those with or without children. There was no significant difference in hours of work, and there was no difference in those who used coping strategies versus not. The program type, weekend versus traditional, did not have any difference. And our last hypothesis, we did note there was significantly higher trait and state anxiety in the cohort of 2023.
So some limitations to our study included a small sample size. Participants were only from the University of Finlay, the timing of which we delivered our survey, the subjective responses given by the participants, and the state trait anxiety inventory tool only looks at state and trait anxiety. So in conclusion, all of our hypotheses were found to not be true, as there was no significant difference supporting these hypotheses. The cohort of 2023 had more anxiety, and we attributed that to 2022 being a year in the program already. Trait anxiety was significantly higher in individuals greater than 30, possibly due to more responsibilities. Exercise and time management strategies were found to be most helpful in reducing stress and anxiety. So some future research could increase the number of participants in the study, perform a longitudinal study across the whole program, and trends of best coping strategies should be considered, and using a different tool that analyzes more types of anxiety. Here are our references.